The Guyana Public Service Union says it is peeved by the recent arbitrary imposition of $150 million for risk allowances for healthcare workers, despite the representative body submitting its proposal to the government of Guyana before the budget was prepared, debated, and passed. President of the Guyana Public Service Union, Patrick Yard, at a recent press conference, told reporters that there were no negotiations regarding the budgetary allocations and their proposal went unnoticed.
We sent to the Finance Secretary proposals to be included in the budget. And we also sent proposals to the Ministry, the Department of Public Service, Office of the President, for negotiations to start. We had to send a reminder recently to them indicating that we submitted to you proposals, you had 10 days in which to meet us, and over 20 days passed.
Yard, who opted not to divulge further on the dollar value of the risk allowances his union is pushing for, would only say that an analysis is being conducted to that effect. He noted, too, that when negotiations do commence, it's possible that the healthcare workers could receive less.
But the negotiations may result in them getting less,
He opined that the budget is not written in stone and that the government can make adjustments in the event of an emergency. Yard maintained that according to the laws of the land, the allocation for the allowance should not have been arbitrarily disbursed.
We don't know which had to pull the $150 million out of or anything. These things shouldn't be arbitrary done. The recognized union should be called in and discussions should occur. An agreement reached. And this has been happening for decades. And it happened almost throughout the period of the last government.
The union has indicated that with support of 500 healthcare workers countrywide, it will be engaging in an intense protest action in resistance of the $150 million that was allotted to specifically frontline workers. The union is holding firm to its position that all healthcare workers, particularly those working at the Gpsu Public Hospital, should be categorized as frontline workers. Minister of Health Dr. Frank Anthony and Chief Executive Officer of the Gpsu Public Hospital, retired Brigadier George Lewis, were both served with fresh ultimatums, which speak to industrial action being initiated within 72 hours if all healthcare workers, especially those at the Gpsu Public Hospital, are not considered in the same vein as those on the front line of the pandemic. Last week, hundreds of nurses in regions 3, 4, 6, and 10 staged several protest actions demanding better treatment, pay, and adequate personal protective equipment. The protest actions were halted earlier this week as the union reported that several healthcare workers on the protest line were being threatened by employer representatives. Timeka Rodney reporting for the HGP Nightly News.